Hello, student nurse. Welcome to Drugs and Intravenous Fluid Calculations in Nursing. This is Porks, and I will be guiding you throughout this process. Before I would formally start, I just would like to say that there is no advertisement intended for the specific brands that are utilized in this presentation. They are only intended to be a learning material and not to be an endorsement of the specific brand. No conflict of interest is also declared in this presentation. Now, oftentimes we encounter this order: Paracetamol 180 milligrams IVTT as needed for temperature of greater than 38.5 degrees Celsius. As nurses, it is part of our obligation to be able to scrutinize this order and to determine the correct amount that needs to be administered to our patient to ensure the safety of our patient. Because in this type of order and in carrying out this intervention, underdosage and overdosage are both possible, and either of which could not be beneficial on the part of our patient. So the question that you are facing is, how many ml will you administer if you're given this order and your patient is febrile? Oftentimes in the nurse's station, you'll be able to see this brand, or you'll be able to see this medication on your setting. So what are you going to do with this? Will you be able to administer the entire ampule that is available, or do you need to pull out only a certain amount and give that to your patient? That can only be answered if we are able to compute the amount of medications correctly. That's why if you are the nurse administering the medication, you should be able to correct, to check, and to counter check whatever problems that may be arising in medication administration. Now, our learning outcomes. In this short session, you are expected to identify the correct formula to be used when you are faced with medications and intravenous fluid. Second, to interpret the physician's medication and intravenous fluid order. You will be encountering a lot of those in your practice. And third, determine the correct amount to be administered, whether that may be your medication or that will be your intravenous fluids. Let's start. Why are we learning this? There are 10 rights of medication administration. Other references would talk about 15 and even 20 rights of medication administration. And the computation of your medications would answer to the right dose. The computation of your medication again would answer to right dose. So we need to give the right dose to our patients. Next, we also have your international patient safety goals. And in your international patient safety goals, your correct computation of medication would answer to goal number 3, to improve the safety of high alert medications. Because with improper dosage, your patient may be able to die, your patient may be able to lose limb, or the life of your patient will be threatened. So to ensure that goal number 3 will be met in your international patient safety goals, we need to ensure that our computation is accurate. For the purpose of learning, I advise that you pause this slide and try to memorize and familiarize the 6 international patient safety goals as recommended by the Joint Commission International. Now, an interesting topic: drug computation. For us to understand how much to give to our patient, we have this formula: Q is equal to D over H times V. This formula would have existed in several versions in different kind of textbook, but the message would be the same. Q would stand for quantity, D is desired dose, and then H would be the dose available at hand, and V would be the vehicle or volume. If you would be exploring several books in pharmacology, there may be other versions of which, but it would go back to the same concept. Now, let's touch them one by one. What do we mean by D? So the D here, class, stands for desired. Okay, D again stands for desired. When I say desired, you think of the doctor's order also at the same time. So your basis for the letter D is your doctor's order. Okay, again, letter D is standing for the desired dose. In other words, how much will I be giving to my patient? how many milligrams will I be giving to my patient? And to give you another hint, that letter D also refers to the doctor's order. How much does the doctor want to be administered to the patient? H, think of your hand, because H here stands for your hand. So whatever is on hand, whatever is the stock. In other words, what is the amount available in the pharmacy? Or what is the type of medication available in the pharmacy? That would be your dose at hand. Then letter V. The letter V there, guys, would stand for volume or vehicle. In other words, what is the amount of the medication that carries, what is the volume of the medication that carries the specific amount of medication intended? Okay. I will be giving you specific examples so that you will be enlightened later on. Let us look at this example. As mentioned earlier, your letter D would stand for the doctor's order or desired. In this case, dear learners, your letter D would refer to 180 milligrams because that is the doctor's order. The doctor would have determined this using the weight of the patient and using the formula that they also learn in medicine. So 180 milligrams will be your desired dose. In other words, that's the amount that I would want to give to my patient. 180 milligrams. Now, what is the dose available on hand? Oftentimes, in pharmacological questions and in the board examinations, this is given to with the term stock. In other words, what is available, what could be within our reach. If you would be looking at this specific example, your dose at hand is this one. 150 milligram per ml or 300 milligram per 2 ml. That would be your dose at hand. Now, you might be asking, which one of these will I be using in case two of them will be available? If you will be applying the concept of your fractions way back in your elementary years, you would understand that 150 milligram over 1 ml is just the same as 300 milligram over 2 ml. So if asked the question, which of the following will you be using, you can use either of the two. Okay, you can use either of the two. Now, again, the desired dose would be 180 milligrams. So if I will be substituting in this formula, allow me to show to you the substitution of the formula. So you'll be able to write this as 180 because that is again the desired dose divided by the dose at hand, which is 150 milligrams, times the volume. The volume this time, dear learners, is your 1 ml. If you have noticed, when it is written as 150 milligram per ml, the 150 component will be our hand and the ml here would be our volume. Although not written, we know that there is a number 1 there. In such a way that if I will be using 300, the formula would appear to be 180 divided by 300 milligrams also times the volume or vehicle this time is 2 ml. Okay, that's how we would be doing the substitution of your formula. Now, before we progress on the computations, I would like you to pause the slide and look at these different kind of medications. Okay, these are different kinds of paracetamol available in our market. And look at the different stocks available. Now, you should have noticed that there are different preparations of paracetamol. For example, this is an IV preparation as indicated here, intramuscular or IV preparation, that's 150 milligram per ml. The rest of the preparations there are oral preparations. If you can notice, there is 100 milligram per ml. That's the pediatric drops. There is a 120 milligram per 5 ml oral suspension for infants. And there is a 250 milligram per 5 ml suspension for other pediatric patients who are age 7 to 12. Which means that even if the doctor would order 300 milligrams, it would also depend on the stock available, if how many ml will you be giving to your patient, because that would vary depending on their stocks. Take note that the stock of the paracetamol is ordered by the physician, and the specific stock may be related to the age of your patient and other considerations when it comes to the diet of the patient. That's why you need to pay particular attention on these labels in the medications. Now, if the physician has ordered paracetamol 200 milligrams IVTTQ for hours as needed for temperature of 38.5 degrees Celsius, which of the following will you be requesting for your patient? Is it letter A, the paracetamol Acnil? Is it letter B, the paracetamol tempra, which is 100 milligram per ml? Is it letter C, the Calpol for infant? Is it letter D, the paracetamol biogesic 250 per 5 ml suspension? If you would look at the labels, the correct answer would be letter A, because it will be intravenous preparation on the part of our patient. This slide is a reminder that we should administer the right drug and the right route when it comes to our patient. We should be able to administer the right drug within the right route for our patients. So be careful, and you need to counter-check the doctor's order. Now, to the computation. Paracetamol 200 milligrams every 4 hours as needed for temperature of 38.5. How much would I be giving to my patient? So your simple formula for that, it's very simple. So for the quantity, remember D over H times V as indicated here. So our D again is 200. Very good. In this case, that would be 200. What is our hand? Our hand would be 150 milligrams. And what is our volume? Yes, that would be 1 ml. If you would pick up your calculators and then type 200 milligrams divided by 150 times 1, that should be able to give you an answer of 1.3333. For our purpose here in our setting, you could use your 1.3 ml as your final answer. 1.3 ml as your final answer. Now, let's look at this example. If we will be doing the computation for this one, you can notice that the desired dose is already different than the previous given. So if you would apply the formula, it will be letter Q is equal to, the desired dose is 300 milligrams divided by, the dose at hand is still 150 milligrams based on what is given here on the side, then times 1 ml. And if you would again pick up your calculators, that would give you a value of 2 ml. Which means that in this case, in this order, we should be giving 2 ml to our patients. Let's have another example. In this case, you have an antibiotic, cefuroxime. Recall in your pharmacology that cefuroxime is considered to be a cephalosporin, meaning it would have almost the same component that of your penicillin, because cross-sensitivity would tend to occur between cephalosporins and penicillins. The hint that this is a cephalosporin is the word ceph or the prefix ceph, such as cefuroxime. The spelling may vary from CEPH or CEF. Now, let's go to the order. The order is cefuroxime sinazeph 750 milligrams IVTT Q8 hour ANST. Remind yourselves, what is ANST? After negative skin test. It is part of our nursing responsibility that prior to administration of antibiotics, we should be able to check for the skin test. But let's go back to the computation. How many ml will be administered to the patient? In this case, we would need to compute. The desired dose is 750 milligrams. The dose available at hand is 750 milligrams. And what will be the vehicle? Okay, notice that this is where I picked up the dose at hand. And what would be the vehicle? In this case, dear learners, it is usual or it is a practice in the hospital setting that a vial of medication is usually diluted in a 10 ml amount of sterile water. So in this case, our vehicle would be 10 ml, unless otherwise it is already given in the problem. And your answer would be even without picking up your calculators. 750 divided by 750 times 10 would give us a value of 10 ml. In other words, you need to prepare 10 ml of this medication to be administered to your patients. That's how it works. Now, let's have a quick review on the intravenous fluid computations. There are three major things that we need or we want to determine when we are talking about your IV fluid computations. These three things are to determine how long will the infusion be. That would answer the question how many hours the infusion would be. Next, how many ml per hour would that be? And the next would be the drops per minute, or how many drops per minute will be used when we will be regulating the IV fluids of our patients. Now, let's encounter the first order. So you have plain NSS, 1 liter times 100 ml per hour. How many hours will the infusion last? How many hours will the infusion last? This is basic arithmetic. So don't try to overanalyze, okay? Just think what is the total amount and then divide it with the amount per hour, okay? The complete order is plain NSS 1 liter times 100 ml per hour. So total amount divided by amount per hour. Okay, total amount divided by amount per hour. In this case, what is our total amount? It's already here, 1 liter. And we know that 1 liter is 1,000 ml. 1,000 ml would be divided by 100 ml. And we know that this IV fluid would be infused or consumed within 10 hours. That would be consumed within 10 hours. What are the applications of this in nursing practice? For example, if this IV fluid has started at 8 a.m., what time do we anticipate the IV fluid to be consumed? If it would be consumed in 10 hours, we need to count 10 hours from 8 a.m. That would give us 9, 10, 11, 12, 1 p.m., 2, 3, 4, 5, 6 p.m. So after 10 hours from 8 a.m. would give us a value that this IV fluid would be consumed by 6 p.m. This helps us anticipate the needs of our patient. Now, as the question goes, if the infusion would start at 8 a.m., what time do you expect it to end? So we expect it to end within the same day at around 6 p.m. Okay, that will help us to regulate the IV fluids of our patient efficiently. Now, if your IV would be infused for 10 hours, let's say the order would say plain NSS 1 liter times 10 hours. How many ml per hour will it be infused? Okay, or how many ml per hour will be infused? Again, this is division. So it would be total amount of IV fluid, say the total amount of your IV fluid, divided by the total number of hours. Divided by the total number of hours. So do not be confused since the computation and given in the previous slide is different. Okay, what was given in the previous slide is the rate per hour, and in this case, what is given is the number of hours it would be infused. Now, in this case, the total amount that would be infused is 1,000 ml, because again, 1 liter is 1,000 ml, and then the total number of hours that we will be working with is 10 hours. And from this, 1,000 divided by 10 would give us a value of 10 ml. Okay, or 1,000 divided by 10 would give us a value of, that would be a 100 and not 10. Thank you very much. That would be 100 ml per hour. 100 ml per hour. If you had some confusion along the way, try to pause the presentation and reflect on your computation. Now, let's apply on nursing practice. What would be the applications in nursing practice? Let's say, for example, that the IV started at 8 a.m. Okay, the IV was started at 8 a.m. of plain NSS, 1 liter times 10 hours. At 10 a.m., you did your rounds. At 10 a.m., you again did your rounds because you're supposed to do your rounds as frequently as possible to check on your patient. At 10 a.m., what amount of IV fluid do you expect to be consumed? Again, at 10 a.m., what amount of IV fluid do you expect to be consumed? Let's count. 8 a.m., that would be 9 a.m., 10 a.m., 2 hours has lapsed. Within 2 hours, how many ml of IV fluid could have been infused? So 2 hours times 100 ml per hour, I would know that supposedly 200 ml of my IV fluids would have already been infused to my patient. And I would know that if my regulation is correct, 800 ml of my IV would be left inside the bottle. We commonly refer to that as your IV left or IVL. Okay, that's the application in your practice. Now, if the doctor ordered plain NSS 1 liter times 100 ml per hour, how many drops per minute will be used in regulating the IV? You might be wondering as to why do we need to regulate the IV. The regulation of your intravenous fluid would be crucial to ensure that the correct amount of fluid would be entering your patient's body. Because underdosage could lead to dehydration, overdosage could lead to other complications such as your cardiopulmonary problems. Okay, you would have your cardiopulmonary overload and cardiopulmonary problems. Hence, we need to be able to regulate the IV. And yes, that is the time of your life wherein you will be counting using your wristwatch with the second hand. Now, in this case, what would be the formula? The basic formula that we use is the total amount of fluid. Okay, again, that would be the total amount of fluid times the drop factor divided by the total number of hours times 60, which means that we are getting the time in minutes. That's why we multiplied it in 60. Okay, so total amount times the drop factor all over the hours times 60. Now, the formula may be a bit complicated, but try to internalize this so that it will be easier for you later on. Now, let's talk about first the drop factor. When I talk about the drop factor, dear learners, there are 3 common drop factors used in the hospital setting. Okay, you have the 2 most common types of infusion set. So you have your macro set, and then you also have your micro set. For the macro set, there are 2 drop factors that are considered. That is your 15 drops per ml and 20 drops per ml. For the micro set, the common drop factor is 60. Okay, 60. You might be wondering, are there other drop factors? Yes, there are several drop factors. So you need to be able to look at the symbol drop on the IV infusion set and look at the drop factor indicated inside, because that will be able to help you determine to accurately compute for the formula, okay, or to accurately compute for the amount of fluid that will be given to your patient. Okay, now with the drop factor, by the way, just for the purpose of learning and definition, when I say drop factor, it is the number of drops that it would take to form a certain ml. Again, it is the number of drops that would take to form 1 ml. In other words, if I am using a macro set with a drop factor of 15, it would take 15 drops to form 1 ml. If I am using a macro set with a drop factor of 20, it would take 20 drops for me to form 1 ml. If I am using a micro set, it would take me 60 drops to form 1 ml. Okay? That's what we meant by drop factor. Now, in this case, in this problem that I am giving you, I would like you to think that the drop factor is 20. I want you to think that the drop factor of the macro set that we are using is 20. You might be thinking, sir, why are we using macro set? For 100 ml per hour, a practical set to be used is macro set. Your micro set is ideally used for an amount of less than 60 ml per hour. Now, go back to the formula. What's the total amount of fluid that needs to be administered? That would be your 1 liter. Okay, that would be your 1 liter. So 1 liter is equivalent to 1,000 ml. So you would write 1,000 ml times the drop factor. Yes, and the drop factor this time is 20 drops per ml. The symbol of your drop factor, of your drops, is GTTS. Divided by, how many R's would this be? If I would compute the R's, that would be 1,000 divided by 100. So I know that this should be consumed within 10 hours. So the formula here would go to be 10 hours times 60. 10 hours times 60. Okay? And in this case, if you would be doing the cancellation, okay, or if you would pick up your calculators, that would give you 1,000 times 20 divided by 600, because 10 times 60 is 600, and that would give you your 33.33 drops per minute. And what is supposedly your answer? Will you answer 33.33 drops? That would be impractical. Remember, we could not count for 0.33 drops. So we round off. That would be 33 to 34 drops per minute. Again, that would be 33 to 34 drops per minute. Okay? That will be for the computation of your IV fluids. You will be encountering a lot of problems related to this. And there's a shortcut. Now, for your macro set, take note of this. For your macro set, if the drop factor is 15, the shortcut would just be to divide by 4. If the drop factor is 20, the shortcut would be to divide by 3. And if the drop factor is 60, you just divide it by 1. What do I mean by this? You focus on the amount of fluid that will be administered within an hour. In this case, the amount of fluid to be administered within an hour is 100 ml per hour. Now, since we are using the drop factor of 20, I said the shortcut is divide by 3. And that would give you a value of 33.33. Just the same as our computation earlier. And then the value is 33 to 34 drops per minute. Try to apply these shortcuts in various scenarios so that you'll be able to practice. Today, you learned something. Once again, this is Nurse P, and I hope that you would like and subscribe. Thank you very much for your attention.